Hi, happy rainy Monday if you live locally here. If you don't live around here, I hope you're having a better day than what we're having here in the Carmel, Indianapolis area. So, today I am talking about bee stings because it was like 80 this weekend and the bees were out and they were stinging. So, let's chat. What to know first? The bee and the wasp stings, and the stinger injects the venom immediately into the skin, causing the reaction. So, bee stings, venom released within a few seconds of the sting. So, it's important to try and act quickly if you can. We all know bees sting one time and then they die, and then wasps can sting multiple times, unfortunately. So, what do you do if your child or somebody around you actually gets stung? So, the first thing you want to do is you want to try to remove the stinger if you witness it right away. So, like I said, they sting, they put in their little venom sac, and then it just releases venom everywhere, okay? So, if they come to you immediately after they're stung, you can try and flick it out. You can take a credit card and try and swipe out the stinger. If they come to you like minutes later and they're like, oh my gosh, I got stung 10 minutes ago. Not much you can do as far as getting that stinger out, most likely. You can try, but the venom has been released and that local damage has already been done. So don't panic. Eventually, these often do work themselves out. If it continues to be a problem, obviously you have to talk to your doctor about that. You want to next wash the area really well, soap and water. Then you want to focus on pain control because it can be painful and it can be itchy. So Advil or Motrin are great if needed for pain. They have that anti-inflammatory effect, so those are going to be your most helpful medicines. Also an antihistamine such as Zyrtec or Claritin. If your kid feels like it's really itchy, you can do that too. Cool compresses, taking a cold rag with cold water, or maybe taking ice cubes, wrapping it in a rag, ice pack, any of that. You can put that on the sting and that can help with pain too. Old school, but I love it. Baking soda mixed with some water into a paste. You put that on the sting too, and it helps neutralize the acidity of the sting, and that can help with pain. And then it's also believed to help reduce inflammation as well. I don't know why I keep acting like this sting is on my hand and I keep touching my hand here. It's making me laugh. Usually people don't get stung on the hands, but they might. So anywhere on the body, you can do this, by the way. So when do you want to contact your pediatrician? You want to contact your doctor in the following cases. Number one, when you have what we call a large local reaction. This occurs in about 10% of the population. It's when you get stung and then maybe 1 to 2 days later, you get this huge, like baseball size red hot area where the sting was. So it develops over 1 to 2 days. It's usually at its maximum size around 48 hours. And then it gradually just goes away. After about 5 to 10 days, it's gone. It's good to discuss this specific case, though, with your pediatrician because sometimes there are certain things that we like to do in these cases and with future stings that may take place. The big and most important thing that you're looking for in kids or anybody, not even kids, adults too, with stings, is anaphylaxis. And in this case, I'm about to list a bunch of things. You call 911, okay? So, widespread hives all over the body, redness and swelling away from the sting. So if I am stung on my arm and I am getting redness in my shoulder and on my neck, hives on my neck, swelling anywhere away from that site, trouble breathing, swelling of my lips, swelling of the tongue, difficulty swallowing, coughing, wheezing all of a sudden when you're trying to breathe and you're kind of hearing this whistling sound, vomiting, diarrhea, any of those that occur pretty immediate onset, within those 20 minutes of that sting, you need to be calling 911. You can also ask anyone around if they have an EpiPen. The 911 operators will instruct you to give that EpiPen, but you should be on the phone with them too. If you know how to use an EpiPen, you know what you're doing. You're pretty sure somebody's having an anaphylactic reaction, you hit them with the EpiPen. That's okay. You do not have to wait for an ambulance to get there, okay? But 100% you want to be calling 911, all right? So that was your PSA on bee stings. I hope it's helpful. If you have questions, let me know. Have a great week.